Oh, good morning, everyone. Welcome to another special edition of Daytime Columbus featuring Licking Memorial Health Systems. I'm so glad to be joined once again by their president and CEO, Rob Montagnes.
I'm really pleased to be here again. We're going to share some of our latest healthcare advancements and initiatives that we offer at Licking County and Licking Memorial Hospital. And I'm excited to discuss some of our recent successes today with you.
Absolutely. We are getting started. Today's Daytime Columbus. And thanks as always for joining us, as today we're going to shine a light on what's being done in regards to a specific life-threatening condition.
Although many people have heard the term sepsis, we have found that many don't know what it is, how it's treated. So today we're going to discuss the basics of sepsis, how the condition is contracted, and its effect on the body.
Yeah, and then it's a team approach for the folks at Licking Memorial Hospital. From the lab to the pharmacy, it is all hands on deck when a sepsis call comes through. Plus, how a sepsis-related initiative in the health system led to lives being saved. Then 5 fast facts to learn about Licking Memorial Health Systems. Well, whenever we contract any type of infection, our bodies usually go to work to fight it off. But sometimes a simple antibiotic can help. But since not all infections are simple, we are going to go further into that, and Rob knows that all too well.
Robin, you're absolutely right. In fact, some infections can quickly become life-threatening. You know, today we're going to talk about sepsis, the complex process to the diagnosis, and how we treat the patients.
Yeah, to kick off the discussion, we are being joined right now by Dr. Philip Savage. Dr. Savage, welcome back to the show.
Yeah, glad to be here.
Let's start with the basics then, though. We both kind of alluded to the fact that many people will hear this term sepsis. They don't really know what it is. In fact, I even had to kind of go to the WebMD, look it up to really understand it. So give us the layman term for what sepsis really is.
So I'll give you 2 definitions. The first definition is the doctor definition. It's an overreaction to an infection. A layman's definition would be you have an infection,
okay,
and your body is trying to fight it, creates inflammation, and things go wrong. The way I like to describe it is your house is, if you live in a neighborhood, your house is on fire, and your body sends not 1 fire truck, but about 300 fire trucks. So it tries to put out the infection, the fire, but it also tries to put out the fire in the rest of the neighborhood as well.
It's so incredible, kind of the complexity, I guess, of this issue. So when a person is diagnosed, then what are the risks to their body? What is happening?
Well, the infection causes inflammation, and you can get fevers, fast heart rate, you can breathe fast. If you're older, you can become confused. And those are signs that somebody has an infection and that their loved ones need to call somebody, 911, get them to the hospital so that they can be evaluated.
You've talked about some of the symptoms. How do we more specifically diagnose that someone has sepsis?
Well, whenever they get to the hospital, we have a protocol, a triage protocol, where they're being evaluated by a nurse, and the nurse looks for heart rate, temperature, respiratory rate, and we take blood work very quickly, and we can see if their white count is very high or very low.
All right, so the mortality rates, unfortunately, those still exist. Let's start with the national average. What is kind of the baseline for mortality?
Well, for every hour that somebody has sepsis, their mortality increases by about 8 to 10%. So that's why it's so important to get to the doctor or get to the hospital quickly. If you wait several hours, your mortality goes up by 20%, 6 hours, 60%.
Wow.
Well, people think about mortality and they think of certainly cancer, various heart diseases. How does sepsis compare in terms of mortality with some of those more well-known diseases?
It's higher. You have a chance to, with cancer, you have a chance to identify the cancer and treat that. It's a more insidious process where you identify it over a period of time. Sepsis is more important than that. You have to get it quickly because the time is of the essence.
Yeah. You know, we've talked a lot about this team approach that they take at Licking Memorial Hospital, especially. And so when you are looking at an issue like you mentioned, maybe cancer, heart disease, you kind of talk about the specialist in this area. When it comes to sepsis, is this really like an all hands on deck situation with every case?
Yes, absolutely. It starts right as somebody gets to the hospital or their doctor's office, and the nurses triage the patient, identify that they have an infection, identify that they have sepsis, and then we have a computer model at our hospital that takes over for there, and then the doctor gets involved and things happen quickly.
Yeah, things do happen quickly, and like you mentioned, I mean, 20%, there aren't many other instances where, that it is a true emergency when somebody's diagnosed with this.
Yeah, absolutely.
And when we talk about this too, do we want to tell our viewers out there, I mean, is it somebody who's had a current treatment that should be looking for these signs and symptoms for sepsis and know to get to the doctor? I guess, how do you even have those early inclinations that it might be affecting you?
If somebody is old or they have other illnesses like emphysema or heart disease, or if they're very young, they have an increased chance of getting infection, increased chance of getting sepsis.
Okay, so it all goes hand in hand.
Yes.
All right, Dr. Savage, I want to thank you so much for being here with us.
Thank you.
Well, speaking of mortality rates, Licking Memorial Health Systems has been working hard in recent years to reduce those exact numbers. We're going to see the extraordinary progress they've made later on Daytime.
But first, we're going to walk you through the process from diagnosis to treatment and the close link between our lab and pharmacy.
So as we continue our conversation about sepsis, we want to move past diagnosis. And Rob, I think this is an important question. So when a patient meets that criteria, when they have been diagnosed with sepsis, I want you to talk a little bit about the initial process when it comes to their medical care.
Well, there are so many team members involved. We really have a multidisciplinary team, and physicians, nurses, but two of the really important clinical areas are pharmacy and laboratory. Making sure the patient gets intravenous fluids quickly and making sure a broad spectrum antibiotic is started quickly as well is extremely important. So Lori, Director of Laboratory, Jean, Director of Pharmacy, being very, very involved in our sepsis care is so important. And I guess I'm not the expert, I'm not clinical, so I'll start with Jean and say, maybe talk a little bit about the broad spectrum antibiotic, how that's all the process, how it's selected.
Sure, be happy to. What I'd like to do is kind of back up. Pharmacy actually gets involved prior to the patient ever coming to the ED, prior to us even thinking about what needs to happen for that patient. We back up, we get involved in the development of the order set, and that really helps drive everything we choose to do with what that patient needs from a clinical standpoint. It really helps the physician immensely make the right choices and kind of takes away the angst that may happen when you have an emergent situation like this. So we're involved with that, and especially the fluid selection, the antibiotic selections that are needed. And it's kind of based on the organ system that might be involved with that patient. The easy thing from pharmacy is we have automated dispensing machines up in the ED right there handy, and we purchase about as many antibiotics that we can ready to use so they can just put those together, use them right there on the spot, and not have to wait for pharmacy to intervene.
Excellent.
And Lori, as head of the lab, you're often tasked with finding the cause. I mean, you have to go to the root of this to begin with. So how is it that you do that? And then how does the testing kind of come into play with that?
For the laboratory, we do several tests to determine sepsis. We look at the inflammatory response, and we also look at what may be happening to the patient as far as infection. So we look at a complete blood count where we look at our white blood cells to see if those have increased. We look at immature forms of those cells, showing that there probably is an infection going on. We look at the patient's coagulation system to make sure that they are not forming microclots in a condition we call DIC. That's a strong indication of sepsis. We also look at different organ function tests, so like liver, kidney, cardiac function tests. We also run a test called lactic acid, which is really a metabolic indicator of the degree of inflammation that's happening with the patient. It's a strong indicator of the severity of the sepsis, so we do that test. We also do a test called procalcitonin, which can determine if the patient does have a bacterial infection versus a viral infection. Probably the most important test that we do run is a blood culture, and we have that blood culture collected before we start the patient on that broad spectrum antibiotic. And with that blood culture, we can tell the physician right away if we see under the microscope, if we see organisms. We can tell them what type of organism it is. And then we can run it on another instrument and tell them specifically the organism in 4 hours.
We've sort of talked about things you do as the patient progresses. Maybe talk about how the role might change for pharmacy or lab day 2, 3, 4, 5 with additional tests or changing of any of the medications during their stay.
Sure. So what we do from the pharmacy, we take and look over the next day or two. We're looking at the labs each day. We look at blood counts, we're looking at temperatures, and we're definitely looking at cultures. So by 48 to 72 hours, we're looking at those cultures and saying, are we able to de-escalate this antibiotic?
In the lab, we do more lactic acids. We will do one at 2 hours and 3 hours after the initial to see if that patient's organ function is improving. We also do procalcitonin many times to see if the antibiotic that the patient was put on is working. And like Jean mentioned, we can de-escalate based on that procalcitonin result. We also would have a sensitivity result available for the physician to tell him or her the exact antibiotic that works for that patient. So there may be a change in the antibiotic the patient's on.
So there's a lot going on with sepsis care throughout the entire hospital.
Absolutely, and Rob, you alluded to it at the beginning. It truly is a team effort. So ladies, thank you for informing us about that today. All right, knowing the threat that sepsis poses to patients, reducing the risk was and is a top priority for Licking Memorial Hospital.
Yeah, so up next, we'll show exactly what we did to dramatically cut down on the dangers and mortality rates caused by sepsis.
We will also learn how Licking Memorial's efforts are being recognized by the entire hospital industry.
Well, back in 2015, hospitals around the state were given a very specific challenge from the Ohio Hospital Association. The initiative was to reduce sepsis-related deaths by 30% within a 2-year period. I was a member of the OHA board at that time, and we recognized that LMH had an opportunity to improve similar to all the other hospitals in the state. We adopted that goal with the intent to significantly lower our mortality rate.
And we are going to see exactly how this was accomplished. So we're turning now to Sally Arnett, Vice President of Information Systems, as well as Heather Burkhart with Acute Care Services. Ladies, thanks so much for being with us today.
Thank you.
First, I want to talk about, Rob, to you, because we're going to talk about a little bit of the numbers. The mortality rates at Licking Memorial Hospital, when you are first given, right, this initiative and set out, tell us where you were starting. Yeah,
we track data on a regular basis, as you are well aware, and the numbers did not come out where we expected or wanted them to be. They were in the mid-20s, and the goal was around the low 20s at the time, I guess, was the average, the goal being in the mid-teens. And so we recognized that we had some work to do, and we really had an opportunity to improve the care we were providing. I think statistically you see that 750,000 cases of sepsis are identified annually. It's got, as Dr. Savage mentioned, a very high mortality rate, and we needed to take some quick action.
So comparing with other hospitals, I mean, that is what most of the time you have to look at, right? Where do you stand amongst others? What numbers were you looking at there?
Well, once again, we don't strive to be average either. We strive to be in that best, upper decile or quartile. And once again, trying to get that percentage down to 15 or below was a goal that we knew was achievable, but was going to take a lot of work, and we put maximum resources to get there as quickly as possible for the quality of care for our patients.
All right, and a couple of those who helped Licking Memorial get to that goal, of course, are here with us. So Heather, I want to ask you, first of all, about the plan. So how did the hospital plan to reduce deaths? I mean, where do you start when you're given this task?
Yeah, so like with any new initiative, we really need to start with education, educating our clinical staff, and it goes across all departments of the hospital. We talked about lab and pharmacy being involved as well. So education was definitely the first step, and then just creating a general awareness about sepsis throughout the organization and also in our community to help people identify it quicker. Another critical component is the time element. Dr. Savage talked about how that mortality increases 8% for every hour that patients don't go treated. So we knew that we needed to have quick action, and so the steps we took to do that were implementing a robust triage process in our ED. So every patient that comes through our emergency room doors, they get triaged for sepsis. If they meet criteria, we call a code sepsis, which elicits an emergent response from the providers, the physicians, the nursing staff to the bedside of the patient. So they're quickly assessing those patients. They're determining whether protocols need to be implemented to treat sepsis, because sometimes there are patients that don't meet criteria, but we want to go and assess them anyways and rule them out if nothing else. So that quick action is really key. Sepsis is really known as a silent killer. Patients present, as Dr. Savage had talked about, with other infections, and that's how sepsis progresses. So our patients show up with pneumonia and urinary tract infections, and so we're so ingrained with treating that illness that sometimes sepsis does go unnoticed. So really creating that awareness, teaching staff how to identify it, and of course how to treat it. So we also recognize that not all patients come in with sepsis through the ED. It progresses during their hospital stay. So we also need to put a process in place on our inpatient units to also triage patients. So, and I think Sally's going to talk a little bit more about the technology, but we feed patient data into an analytics tool that then categorizes patients, either rules them out or they're septic, sepsis, severe sepsis, or septic shock. If they fall into those categories, we also send out automated alerts to our providers, so the physician that's caring for the patient and the nursing staff. So again, it's that prompt attention to that patient, getting to the bedside, assessing, determining whether protocols need to be implemented. And while all that's definitely key to our success, another big component at Licking is analyzing our data. So looking at that data, real time, retrospectively, determining if we have outliers. If we do, we know that we have room to improve, and we put process improvements in place for that. And as mentioned, it's interdepartmental. It's across all departments. From the emergency department, inpatient units, our physicians, nurses, pharmacy lab, collaboration with our IT team, leveraging the technology that we had in place to really identify these patients quickly and make sepsis a top priority.
So let's talk about the technology. You've highlighted the fact that we have so many different departments involved. Many of them are departments folks would think of, but IT sort of providing the information not only initially but throughout the entire stay and having it be real-time information that can be used by the clinicians. Talk about the importance and the role of IT, Sally.
Well, Rob, as we walk through the process, actually over the last 3 years, we've been really focusing on dealing with our identifying sepsis more quickly, as well as decreasing our sepsis mortality. So as Heather mentioned, we really work hard to utilize our electronic health record and the data that we collect on all of our patients in real time to actually catch sepsis as it's happening. We use sort of a red, yellow, green methodology. So we have what's called a visual status board. It actually evaluates the patient in real time, and it collects data on 38 different aspects of things that are happening to the patient at any given point in time, every patient in-house in real time. So green if the patient is doing well, yellow if we might have an issue with sepsis, and then if that patient raises to a higher level of severe sepsis or septic shock, the board actually flags the nurse as well as flagging the physician. So the board will actually send a secure text message directly to the physician's cell phone. So Dr. Savage would get a message on his mobile phone letting him know he needs to go immediately to see that patient to evaluate them for sepsis.
And all of this hard work, Rob, I want to get to the numbers quickly. So how successful were you towards the goal?
Well, I think the outstanding work of our clinical folks, the IT, the entire group, we saw a tremendous improvement. I think we have a graphic up right now, 70% reduction. We've been consistently at 9 to 10% in terms of our mortality rate, coming down from the mid-20s. And I think you graphically see there off to the right how many additional folks are alive today because of the outstanding improvement and quality care they receive at Licking Memorial. So we're really proud of the work that all of our employees have done on this.
All right, we're going to get a little more into that. If those numbers aren't enough to make you extremely proud, Rob, of course, we're going to let you continue to some success stories with 5 more facts that you need to know. All right, now it's time to look at 5 important facts we should all know about today's topic. We have shared sepsis is a threat to all healthcare providers, and Licking Memorial has done all they can to reduce their threat to its patients and continue to do this every day, Rob. So I first want to recap with you kind of the dangers. How common in reality is sepsis?
Well, it is the leading cause of death in U.S. hospitals, and it significantly higher than things that people would come to mind, like heart issues, cancers. Sepsis is a significant mortality risk for folks.
1 in 3
Yes.
is the number, which just puts it into perspective. So when you launched your efforts at Licking Memorial Health Systems to reduce sepsis, you saw this dramatic improvement. You mentioned the number 70%, which is huge. So how many lives does that equate to?
Yeah, I think it's important. Sometimes if you get lost in just the percentages or the statistics, you don't recognize that individuals are affected. So we like to try and translate that into a number of individuals, and it's 177 folks that are walking, living, enjoying life in Licking County because of the great work our folks did.
That's incredible. All right, I imagine the things you learned, the steps you took, now has become your standard practice.
Yes, I think the processes we put in place will sustain us into the future while we always look at ways to improve even more. They continue to really afford us to provide great care to our patients.
Rob, who makes up the team on the front line? We mentioned it is a team approach when you are fighting sepsis.
Yeah, I think we've talked about all these areas throughout the entire program. Certainly the ER, working with folks in the community like the squads, lab, pharmacy, information systems, nursing, physicians. It's quite a collaborative effort.
All right, let's talk a bit about early sense technology. What exactly is that? How do you utilize it?
Early sense is a technology that continues to provide data to our clinicians on a regular basis. Heart rate, respiratory rate, information that allows them to even identify sepsis, maybe before most would be able to identify it without that regular information. So it's a great technology that we use throughout the entire hospital.
All right, Rob, LMH also recognized for its sepsis initiative, which is, not hard to believe when you talked about the successes of it. So, tell us how the industry, right, is recognizing what you're doing.
Yeah, I think we do things to better care for patients. We never enter into a project or an improvement opportunity with the goal of winning awards or being recognized, but certainly various awards from the OHA, from other organizations for the great work our folks have done on sepsis, and we're happy for that.
And I just want to mention, in talking with some of the guests that have been on our show today, Rob, we've also mentioned how others are now leaning on you guys for this experience, to share how you've done this, to share these best practices. And hopefully what you're doing here in Licking County is kind of resonating across the U.S.
Well, we recognize that we have an obligation to help others improve, but we also recognize we can learn from others. So anything we can share to help another facility, we're happy to do that. And we recognize we have to be humble enough to know that we can always take ideas from other places as well.
Right, absolutely. All right, Rob, another great discussion about the ways Licking Memorial Health Systems is constantly working to change and really improve the community's health.
Great to be here.
And knowing that you guys make an impact, obviously very gratifying. It's why you do what you do. So I just want to let everyone know that it is always a great benefit to have you here and to kind of share what you're doing, because not a lot of people know what goes on behind the scenes of a community hospital. So
I appreciate the opportunity, and I always love the questions and the exchange.
The opportunity to share. All right, thank you guys. As always, be thankful for today. I will see you Monday.